Years ago, I took a full panel STI test, which said I was negative for everything, including gonorrhea. But I had gonorrhea and I was spreading it. And that happens much more often than you might think. Now, today I own an STI testing company because I am bound and determined to not let this happen to another person. And that's exactly what we're going to cover in today's video, how you cannot be a victim of the system like I was. Oh, and if you're somebody that says, I don't need that, I just asked my doctor for a full panel, you need this more than anyone. Everybody wants a list of infections to get tested for, and don't worry, we're going to cover that later on. But first things first, you need to understand that a competent STI test in the United States, if you're getting tested to find out if you have a sexually transmitted infection, is going to involve blood. It's going to involve an oral swab down the back of your throat. It's going to involve an anal swab, and I'm not going to make that motion, but it's the same thing, just somewhere else, let's say. And it's going to involve a urine test or a genital swab. Those four things. If you take even one away, it's not going to test you properly. I know that is a bold claim. Don't you worry, I'm going to back it up in just a few minutes. The next thing you need to understand is that the phrase full panel STI test means absolutely nothing. If you go in a doctor's office and say, I want a full panel STI test, that doctor will order you some tests. Are those the proper tests you should be getting? Who knows? Because that's not a term that's used in the medical field. It's even worse online, where people use that phrase as a search engine optimization. They want to rank on Google for that phrase because they know that you're going to use it. But friends, it means absolutely nothing. If you went to 10 different doctors and asked for 10 full panel STI tests, you would end up with 10 different sets of infections tested. So never use that phrase. Instead, you want to ask for the specific tests that you want to be tested for, and we're going to cover those in just a few minutes. The next thing to talk about is what's called window period. And this is the period of time after an exposure that you might test positive for. In other words, if you had sex with so-and-so on this date, when can you test to know definitively that so-and-so did not give you an STI? That's window period. Now, the truth is all of these STIs have different window periods, and it also depends upon the type of test. So it also depends upon the lab that you're using, believe it or not. So it's a little more difficult than it appears. Now, I'm going to put a slide up on the screen because if I don't tell you some window periods, you guys are going to get super mad. By the way, if you like this information, you can screenshot it, leave a comment, really helps with the algorithm. But gonorrhea and chlamydia, for example, is 2 weeks. That's the window period for gonorrhea and chlamydia with most assays used in the United States, but it's all different. Next, I'm going to encourage you guys to stop panicking. Easier said than done, right? Believe me, I know, I've been there. Now, if you're blowing up with symptoms, that sort of thing, obviously go to urgent care, go to your doctor, that sort of deal. But if you're just getting screened asymptomatically, it's not urgent and it's not an emergency. But when people start panicking, when people want to get tested now, really what they're trying to do is address an anxiety response that they're having. So they had a questionable sexual experience, and now because of guilt, because of the type of sexual education that we had in school, they feel like if they can just get a negative STI test, that they can put that whole thing to bed, pun not intended, and then they will feel much better about it. But the problem is when you start panicking, when you start getting anxious, you start to make some really bad decisions. For example, there's companies out there selling HIV early detection testing, and the rest of their panel is not really very thorough. So great, you found out you didn't have HIV, you probably didn't have it to begin with, but now you also don't really know if you have these other STIs. Or this is when people test too early. Remember, we just talked about window period. So it's much better to be on some sort of schedule. If you're sexually active, be on some sort of schedule. And that brings me to the next one, guys, which is that thoroughness matters so much more than timeliness. Why do I say that thoroughness matters more than timeliness? Well, because a lot of the most common sexually transmitted infections are rarely tested for by physicians or STI testing centers, and definitely by online STI testing companies. For example, the 3 most common sexually transmitted infections that I see on our test results at shamelesscare.com are oral gonorrhea, Mycoplasma genitalium, and trichomoniasis. And I can pretty well guarantee you that less than 1% of you watching us right now have been tested for any of those 3 things. So let me give you an exaggerated example. Let's say you get a syphilis test every Tuesday afternoon at 3 o'clock, and you do that for 10 years. You get 520 syphilis tests. It's still never going to tell you if you have trichomonas, and trichomonas is the single most common curable sexually transmitted infection in the United States. So I'm sure you're getting my point here, guys, which is that we all have limited time and we all have limited money. You're not going to be able to get the most comprehensive test available every single day, nor should you. How often you're tested is up to you. It's up to how many sexual partners you have, how much money you might have, what resources are available in your community, and even how much time you have. I can't tell you what that should be. For some of you, maybe it's once a year. Maybe it's twice a year for some of you. Some of you, maybe it's every month. I don't know, but what I can tell you is that if you're not tested thoroughly, then you're never going to find out if you have one of these super common sexually transmitted infections that can harm your health. All right, let's go back to those collection methods. So let's start with blood. Generally speaking, blood is going to be checked for HIV, syphilis, hepatitis B, and hepatitis C. Next is going to be an oral swab, and that's going to be used to check for gonorrhea and chlamydia. Those are bacterial STIs, and remember I said they're site-specific. So whenever I spread gonorrhea after testing negative for gonorrhea on a full panel STI test, hate to be sarcastic, but it's also hard not to be a little bit upset about that even years later. It's because it did not include a throat swab, and these infections are site-specific. 86% of our positive gonorrhea cases at shamelesscare.com are oral only. Had we not included a throat swab in that test kit, those patients would have been told they were gonorrhea free. So an oral swab for gonorrhea and chlamydia. Now, an anal swab is also for gonorrhea and chlamydia, and same story there, except anal chlamydia is much more common. Now, interestingly enough, anal chlamydia has been detected in many people, according to multiple studies, who deny a history of anal sex. And that's why it's important that everybody, regardless of your sexual orientation, gets anal swab. So far we've covered blood, oral, and anal. Now we're going to talk about genital. Next is going to be a urine test or a genital swab. And this is basically checking the genitals, primarily for gonorrhea and chlamydia, but also trichomonas, Mycoplasma, genitalium. It's going to vary depending upon what that clinician includes in the testing panel. But basically, you're collecting a sample from the genitals. Well, the next thing that you need to know is that asymptomatic screening for herpes is not recommended and rarely done, and for good reason. First of all, who doesn't recommend it? Who gets to decide this? Well, there's a group called the United States Preventative Services Task Force, and they basically look at preventative screenings like this and decide, is it good for people or is it bad? And they have decided that this is bad. There's two main reasons for that. One of which is you're telling people who don't have any outbreaks. Remember, this is asymptomatic screening. If people were having outbreaks, they would probably know they have herpes, that they have herpes. These are people with no pain, no discomfort, no outbreaks. Because they're not having outbreaks, it's less likely, though not impossible, but less likely that they would be to spread it. And you're telling them they have this lifelong incurable condition that they might feel quite bad about. And what are they really supposed to do with that information? Never have sex again? That's part of it. The other part of it is that there's a relatively high rate of false positives. And so now you've given people all of that stress and guilt and no actionable, there's no cure or anything like that. And some of these people don't even have the infection. And for that reason, it's not recommended, rarely done. And to tell you the truth, it's probably something that you should avoid as well. Now, the next thing to understand is that some of the tests sold online include random things that are not even STIs, believe it or not. For example, there's tests out there that include Mycoplasma hominis or ureaplasma. Neither one of those are classified as STIs in the United States. They can be in your body and completely harmless. If they're going to be tested for, they need to be tested for in a way where the lab test can determine how much of that bacteria in your body you have. And then a clinician like your OBGYN, etc., who has that information and information about your symptoms may decide to treat you. Now, I don't know why companies include those, but I do know that when you're marketing against other STI testing companies, and I would know It is so tempting to say, well, I have an 8 panel. Oh, well, I have a 10 panel. Well, I have a 17 panel. There's a little bit of that going on, and you should probably just be aware that you might test positive for something that's not an STI and that, quite frankly, most people have. So now you're probably wondering, what should I be tested for? Well, there's actually quite a bit of debate about this. There is no right or, well, there is a wrong way. A wrong way is selling someone an STI test, saying it checks them for gonorrhea, not telling them anything about oral swabs, letting that person get gonorrhea and then spread it when you told them they were gonorrhea free. I would argue that's wrong, and that's part of why we don't do it at my company. In fact, why I started my company. But I digress. Other than that, there is a little bit of room for debate here. Okay, for example, that same government agency that says not to do the HSV asymptomatic screening test also says that heterosexual males like me, there's no reason for us to get screened for gonorrhea and chlamydia. Obviously, I don't agree with that. I've had gonorrhea in my life and spread it. I think we've covered that already, but you get my point. So there is no right or wrong answer here. I can tell you what we've decided to test for at shamelesscare.com is 14 different sexually transmitted infections. You can click the link below, look at that. You don't even have to buy the test from us. As a matter of fact, you can screenshot it, take it to your doctor. I don't care. Now, last thing I want to talk to you guys about is free STI testing, okay? I'm a big believer in taxpayer-funded STI testing. I wish there was more of it, but the simple truth is that it is rarely thorough. In fact, sometimes it is very misleadingly not thorough, okay? For example, I was just recently at an event where they had free STI testing, and it was HIV, syphilis, and hepatitis C. That is in no way, shape, or form a comprehensive STI test. But if there's one thing that I've learned from going to events and talking to thousands of people about STI testing, it is that people think that if they've gotten an STI test from a provider, that they've checked the box, they've done the thing, they don't have an STI. And that is just not true, because there's no such thing as a full STI panel. STIs are just a series of infections, and they each have their own test. And that STI panel that you got is just a series of tests. And it could be a very uncomprehensive or very comprehensive, but that's the part that matters the most. Well, I'm Robert from Shameless Care. Thank you so much for watching, everybody, and we'll talk soon.